Hi everyone, welcome to my video. I am going to talk about something that not everyone talks about on YouTube who is in PA school or who was in PA school. Um, a lot of people post about their success, about how great it is to be in PA school, how great studying is going, how great your rotations are going, or all the learning experience, and it is great. I have been there, and from my point of view, it feels great when you know the answer to a question. It feels great when you understand the process behind diseases and you know what are the best treatment options for your patients. It feels great. Like it's a growth. It's part of the learning process, and you do feel satisfaction from doing what you're supposed to do. I started my clinical rotations. I was doing excellent patient interaction, physical exam, diagnosis and treatment. Everything was going great. But I am not in PA school anymore. And this is something that a lot of people don't want to say because of different reasons. It is catastrophic. It is a big thing to go through. Um, you know, hold on, my coffee machine is going off. So I'm making some coffee over here. This is an old fashioned machine, and I like it because it really extracts the best out of the coffee bean. This is the one I'm using. Yay! Here it comes. Okay, I'm back, and I got my coffee mug from Dominican Republic. So we were talking about PA school. I was so excited to go on my first clinical rotation, and the rotations were going great. But something happened. My preceptor had a bit of a temper, and sometimes he would, tell me things that were kind of harsh and mean. Uh, but you know, they have a word for nurses. They say nurses eat their youngs, and I was like, do PAs eat their youngs too? He was putting me on the spot, and I understand it's part of learning, and that's how I took it. I took it with an open mind. I was very receptive, things like that. But he would get very annoyed every time I asked him, "Oh, sorry, can you repeat that?" And I would ask him that um, more than once or twice a day. Like I was him, "Sorry, can you repeat that?" And I saw that he was getting annoyed, getting frustrated. He thought I wasn't listening. One day he took me to a conference room that was all the way in the back of the building, and we walked back there, and I thought he needed help with something. He told me come, and he started walking, and then I just started going after him, and he told me sit right there, and I sat there, and he told me, why are you here? And I said, oh, I'm here doing my rotations, I'm here to learn. Well, it doesn't look like that, blah blah blah. And then he said, when I talk to you, I feel like I'm talking to a wall, to a brick wall, he said. And if you keep this up, you're not gonna pass this rotation. I can just have you shadow me for the rest of the rotation and not see any patients on your own. If you want that, we can do that. You know. And he was angry, like his face was angry. And I told him that um, I do understand that I ask him to repeat himself sometimes, but it has nothing to do with me not listening. And that I apologize that has been his perception. That was all I had to say. I wasn't trying to be defensive or anything like that. Um, and but it was strange. It was strange. Um, and the reason why I asked him to repeat himself was because this person comes from a different country. and their English accent is you know, like the words are like kind of muffled, and like towards the end especially the vowel sounds kind of diminishes, and I always had hard time with some words, that he said. Sometimes he would speak very fast and muffled, like whoa, you know kind of fast. And then at the same, like he always liked to talk and walk at the same time. So when I was following him along the hallway, he would talk and he would walk fast. So I'm like trying to catch up with him at the same time trying to listen. And sometimes I had to ask him to repeat himself because certain things that he's telling me are very important. About patient care, about what to do with certain patient populations, treatment options, and things like that. So I had to ask him to repeat himself, and I thought that that was not a problem, but it definitely was a problem, and he wasn't happy with me there at all. Um, at the end, he gave me a really really bad review. I wasn't expecting it. I thought he was under. I thought he knew that he had an accent from a different country, and I thought that he would understand when people ask him to repeat himself, because this person has been in this country. He told me he has been in the U.S. for like 20 plus years. I told my school about the initial communication. He told me, things that were or that could have been said in a different way, like, you know, if you keep this up, you're not gonna pass this rotation, as if he had any power on whether I passed the rotation or not. Yes, he gave me yes, he gives me an evaluation at the end, but that doesn't determine if I pass or fail. But he really felt like he could use that argument to make me believe that he could actually fail my rotation. Well, um, I told my school. They told me just be receptive to his feedback, and we see that you're seeing this with an open mind, which is good. Well, that's everything that the school had to say at that point. I opened my ears, and I really, really, really wanted to focus on him talking to me after that point. It was very scary to have him tell me, things like, "Oh, you're not gonna pass this rotation." No, that was scary. At the end, for the day of the evaluation, he pulled up the email, he put it in the screen, and we were there sitting, watching him fill out the evaluation. He was going through it with me together, and oh my god, every single thing he started, "Oh my god, you're terrible at this, you're terrible at that. Oh, you don't know how to do this, you don't know how to do that." Everything, as far as patient management, diagnosis, things like that, professionalism. He rated everything with the least amount of punctuation, and that really, was very hurtful for me to hear him doing all this at once. Like, he never actually addressed anything beyond the part where he thought I wasn't listening. But everything else, the first question asked, "Did you address any of your concerns with the student?" Yes, that was a lie. And then he continued, "Professionalism wise, he put my reputation on the floor, and it was very bad." And then at the end, he told me, "Oh, you have not improved. You are the worst student that I ever had here. Never had any student that was as bad as you." And all those things were hurtful. And he criticized my clothing. Um, I was notified by my school that he said something about my clothing, and they told me, just make sure you always have your white coat, make sure you always have um, your logo, your thing here, and I always did, but that wasn't his problem. And he criticized. I had a shirt like this, you know, like a button up. It was a shirt with like squares, kind of, no logos, no. It was kind of like this, okay? It was similar shirt, different color. It was like it was like this color right here, with white and blue. And he told me your clothes are casual. You know, it was everything about me that was wrong for this man. Everything was wrong. And I showed a picture to my school how I was dressed that day. Button up shirt, white coat on. My pants were, regular khaki pants. Um, and I just couldn't figure out like what was wrong. When I started the rotation, I sent him an email. Is there anything that I should know about this rotation besides schedule and parking? He didn't mention anything about clothing. I didn't think of clothing. And I just kept wearing my, button up shirt with my white coat. Sometimes I would wear the scrubs with my, logo on. And he never said anything about clothing. In a healthcare setting, you always either white coat with your button up shirt, or you wear scrubs with your name tag from that the school gives you. And that's considered professional in the healthcare setting. But he thought my clothes were casual. And I like, to this day I don't understand what that meant, casual. Because if he meant business casual, okay, maybe, I can use the same outfit for different settings, but the fact that I have a white coat on makes it, healthcare setting. It's not casual because I cannot wear a button up shirt and a white coat at Walmart or at a job interview somewhere. I cannot wear that, only in the healthcare setting. So I told my school was not supportive at all. My school, they said they have to investigate, blah, blah, blah. They put me, because, this evaluation is all negative, they put me on hold for my next rotation. And that was very hurtful. And on the same day of my end of rotation exam, I wasn't okay. I wasn't feeling okay. I was nervous. I kept thinking of this last confrontation with my preceptor, in which he told me I was a really bad student. No one there was as bad as I was. Uh, and I just kept thinking of how much points they would take off due to the evaluation. I just kept thinking, like, this evaluation is really gonna hurt my grade. It's really gonna impact my grade in this rotation. I can only afford to lose so many points. And it was very psychologically challenging for me to go to my end of rotation exam and my OSCE with all these negative emotions inside my head, and also knowing that my school wasn't really helpful. I had a lot of pressure on my shoulders, and I went to my end of rotation exam, um, and I made a mistake on my OSCE. I documented my OSCE in the wrong spot. I remember, like, walking into the after I did the physical exam and everything. I go to the uh, documentation room, which was separate from the patient examination room. And when I get there, I tell the proctor, like, hey, like, what am I supposed to do? And the proctor tells me, I don't know what I'm supposed to do. And I just looked around, and I see that all the students are sitting, but they're not using their computers. They're using the programs, the university's computers. And I thought, okay, I guess I have to go write a soap note. When I go in the computer, I see the Moodle page is open. The Moodle is the place where we put all our assignments. The Moodle page is open, and there's a lockdown browser is on. And I asked them, okay, I have to log into Moodle. So I log into Moodle. I see there's a quiz open. I attempt the quiz and I start answering all the questions in the quiz. The last three questions were kind of not related to my case, but I thought they were related to someone else's case and that they would um, not apply to my case. And I just wrote not applicable for those last three questions. Little did I know that the the quiz that I attempted was not the quiz that I was supposed to attempt. My proctor was supposed to tell me which quiz I was supposed to attempt, um, and she did not. So I kind of just figured it out on my own. I attempted, the quiz that I saw. I was under a time clock, and I had to complete my quiz, in a timely manner. I knew I had to document my visit with the patient, and I knew that I had to do it in a timely manner because the time is running, and it's an OSCE. So I go in and I just start filling out the whole quiz. They were asking questions like, "Did you do a physical exam? Like, were there any abnormal findings? Things like that." And um, I was notified by the faculty that I documented my quiz, my OSCE in the wrong place on Moodle. They asked me if I was aware of it. I told them I was not aware of it. And they told me, oh, didn't the last three questions kind of guide you to think that you were in the wrong quiz? I told them, not really, because I'm in a group of 30 something students, and we all have different cases. So I thought that what I'm filling out does not pertain to them. I mean, may not pertain to me entirely, and may pertain to them. But I told them I have all this information fresh in my mind, and I can just go ahead and fill out the right quiz. But they didn't allow me to do that, and that ultimately, the my grade from the OSCE and the um, preceptor evaluation were very low, and I ultimately failed my rotation. I felt really strong when it came to the OSCE physical exam. Hello, my name is Blas, I'm a BA student. Go through all the HPI questions, go through the ROS, physical exam. It was a physical exam, very easy. I didn't have any, my patient really didn't really have any major complication. Yeah, my patient had a history of certain medical condition, and I did all the physical exam for, hypothyroidism, brittle nails, coarse skin, alopecia, weight gain, and fatigue. I went through all these, and I just couldn't document it. I I felt really strong about my OSCE, and I was like, wow, I did great on my OSCE. So with this OSCE, I'm gonna, boost up my grade, and that preceptor evaluation is not gonna have any weight on my grade. I felt really strong about my OSCE, but I was wrong because I documented it in the wrong place, and my faculty was just not letting me do any any fixes to anything. Well, when I learned that I wasn't able to fix it, then I really knew I'm screwed. And I thought that was the end. Because if I'm not allowed to document it, then they're not gonna grade that portion of the OSCE. They're only gonna grade my physical exam, which is gonna be what? I don't know how much they're gonna give me for that. And I failed. I failed my rotation, and they kicked me out of the program. And I really wanted to go back there and um tell them how everything happened and everything, but they rushed it, and they kicked me out. And I what am I gonna do now? Like, okay, it's over. What am I gonna do now? I was terrible, feeling terrible. I went to my PCP. Um, I was prescribed some medicine for depression. Um, Everything started with this preceptor tell me all different hurtful things that kind of internalized in me. And at that point, I didn't know I was professional anymore. Like, what is professional? Like, if I'm not professional, then what is the definition of professionalism? So a lot of self-doubt and a lot of self-questioning. What did I do wrong? Like, what exactly do you mean by bad professionalism, or by bad clothing, or not appropriate? Like, what is it? You're not giving me a definition. Everyone else tells me. Even some faculty members in my school were like, Blas, like, I have never ever experienced like any, you know, behavioral problem from your end. And they assured me that my clothes were fine, were appropriate, but I just don't understand. You get through didactic year, you maintain great reputation in your school, and then they send you to a hospital where the subjective evaluation of a random person has a lot of weight on your grade, and also on your emotional well-being, because if you're being told all these diminishing words right before your exam, and that can really impact the way you feel towards your exam. I guess it affected me a lot because I I was vulnerable. Last year, and a couple months ago, like we're in March, I got kicked out in February. It's been like a month since I got kicked out. I hate being home. I can't stand it. It's psychologically, stressful to deal with, seeing my stethoscope and my clothes here and not being able to, do anything with it. It's really bad. Last year I lost my grandmother and my grandfather, both in the same year. To many people in the American culture, first world country, individualist country, like a lot of people call it, um, they may think, oh yeah, grandmother, grandfather. Well, to me, my grandmother, my grandfather were my parents because I grew up with them. I lived with them ever since I was 4 years old, and it is big thing to lose them both in the same year. So I was a little bit vulnerable. I have to say I was a little bit vulnerable to begin with, emotionally. And yes, I was doing great in my rotation, but having this person come to me and tell me also all sorts of hurtful things was something unexpected, and was something that I wasn't prepared to deal with, and to deal with by myself, because my school was not supportive at all. They could have been supportive all the way since my initial email early in the rotation, like a week early in my rotation. I sent them my initial email. They could have been supportive all the way from there, but no. Not to mention, I have 4 preceptors, and only the one that didn't like me got to submit my evaluation. And my school got extremely mad when I asked the rest of the preceptors to give their input. My school was extremely mad at me for that. Well, it is what it is. It is what it is. Not everything in PA school is colorful. Not everything in PA school is wonderful. I know it's a great profession. It's a great field. But when you go into the hospital system, or the office, or the office, or doctor offices, you don't really know what you're going to encounter there. And you have to be prepared for the best and for the worst. Because there are people out there who are going to look down at you, and are going to doubt your ability to become a PA, and they will simply not want you to become a PA because they don't think you can become a PA just from their point of view. It doesn't matter if you got through the entire didactic classroom year. It doesn't matter. These clinical preceptors will, if you let them, they will really hurt you. And I say if you let them because if you're really strong, if you have a really strong personality and whatever they say to you just goes in one ear and out the other, and then you go and you ace your exams and your OSCEs, you'll be good to go. But if you're someone like me who at the time was vulnerable and all these mean things impacted me and kind of resonated with me, then it's a really bad thing, especially not having the faculty support there backing you up. It's really hurtful to deal with all these things by yourself. um and yeah, I wanted to fight it with the school. I wanted to submit an appeal and go that route, but I'd rather move forward with my education. I'd rather take my transcript somewhere else, and I have a great foundation. I have all this clinical knowledge. I went through the entire didactic year from PA school. I went through that one clinical rotation, and I learned a lot from it, I had to say. And one thing that I take away from this, one thing that I took away from this rotation was that I was never wrong when it came to diagnosing a patient. Maybe treatment wise, yeah, some providers have different preferences. Maybe I forgot something one day, but diagnosis wise, I was never wrong. I always knew what the patient had. I always did the physical exam that was pertinent. For that, maybe a little bit over. Oh, extra is better than not being able to fulfill the requirement. But I was always right when it came to my diagnosis. And I diagnosed some bizarre things. The first thing that I diagnosed was a mid diastolic murmur. I didn't know what it was exactly, but the patient ended up being referred to cardiology. And we really didn't have, we didn't do any EKG or anything like that in the office. This patient didn't come there for that. Then my preceptor decided to forward this patient to cardiology. And then another thing that I diagnosed a lot of knee conditions, ligamental tears, meniscal tears. I diagnosed impingement syndrome of the shoulder. Not frozen shoulder though, because frozen shoulder is like you can't move it at all. But this patient was able to move the shoulder all the way here, but he couldn't do any overhead movement because it would hurt so much. I diagnosed otitis medias. I diagnosed pterygium in the eye, hordeolum, all these things. I diagnosed a macular, not macular. I diagnosed retinal detachment, a bilateral retinal detachment. So many things I diagnosed. I diagnosed COPD, asthma. I guided treatment for asthma and COPD. What else? So many things. I was, really proud of myself for this. And I really think that I belong on the bedside and that this is not going to stop me. And instead of fighting it with the school and causing myself more depression and more psychological distress, then I'd rather take my education somewhere else where I can find support and where, I can be more aware that next time they send me to a hospital, then, I really need to be careful and watch for signs of people wanting to do harm to me in my future, my career, and be, more consistent when it comes to seeking faculty support. Because even though they knew what I was going through and they could have done something about it, um, I could have, pushed, further. I could have, maybe go to the, program director, or even the dean, go even, further with this. And I could have done that. But it was I had a very little time to do this because between, that very, very nasty, confrontation with my preceptor, um, and my exam, there were just 2 days in between, and between that I had to study, and I had to work on myself, and kind of, put away all these thoughts and just focus on my exam. But there was very little time in between, and that ultimate OSCE mistake, I wasn't really, expecting that. But I rather, instead of fighting this, I rather just take my transcript somewhere else, and not my transcript from the PA school program, because once you fail PA school, you cannot take those transcripts anywhere. But I mean my transcripts from my undergrad and my prerequisites. I can go somewhere else. Right now, I'm gonna say I'm not gonna become a PA. I am gonna go another route with my education. I will, yes, I will still want to be, I'll still be in healthcare, and I'll still, move forward to become a healthcare provider, but not a PA. It's gonna be a different form of healthcare provider. And yes, I love the primary care setting, but you know, I don't know down the road what else am I gonna see, what else am I going to be exposed to in the next field. I'm excited. At the same time, I'm a little bit desperate because I have to. It's March, and I have to wait for the fall to really begin to study again. I want to do it now, but I guess I can use this time to, just continue taking my medication, and hopefully all these depression symptoms are gonna go away. And um, it's interesting how I found out I had depression, because I was asking my patients in the clinic, my I was asking them the PHQ-9 questions, all the depression questionnaire questions, and some of them applied to me actually, and there were patients that came in for depression actually, and I identified myself with them. But at that time, I'm in the middle of my clinical rotation, and I am busy and I'm studying. So what time do I have to really take care of myself if after 8 hours of being at the clinic I have to come home and study, and I have to come, home and do all the things. So, and I thought that my depression wasn't really bad enough to prevent me from doing things, and it wasn't. My symptoms are actually triggered by negative interactions with other people. So once I started avoiding certain family members and I started avoiding certain people, I noticed that I don't have these symptoms anymore. I don't have these depressive thoughts anymore, these PTSD symptoms anymore. But my preceptor, he knew how to trigger every single symptom of me, and he did. But I'm gonna put that in the past. Gonna put that in the my rear view mirror. And with this, I just want to encourage people to tell us their story. Not everything in PA school is great, and not everything in the clinical setting is great. There are a lot of clinical preceptors in the hospitals, either doctors, nurses, PAs, NPs, that are terrible for students. And your school has no control over that, because your school actually relies on them to take students in. So the school, sometimes they don't want to address these issues because they don't want to lose their clinical sites. And that's how I felt that my school was handling the situation. They didn't want to lose their clinical site. or risk not being able to send any future student there. If you have any advice for me, put it down in the comment. By the way, who are you? Who are you?
I'm your boyfriend.
Show your face. Come here. Come here. This is my boyfriend Sam, by the way. He has been very, very supportive. Sit down. And he's the reason why I am still fighting and I am still moving forward and I am trying to, make something good out of this. I don't know where I would be if it wasn't for him.
No.
Okay. And he himself is trying to get into physical therapy school. He's in his undergrad right now. And we're both, trying to get into something healthcare wise. Okay, go away. Thank you so much for watching, and I am going to update you on my next journey in healthcare. What am I going to be doing? What school I'm going to be going to? I actually have a few options here and there, and very nervous because I don't really want to go away from home. I want to be here. I really like being with him here. He goes to school nearby. My mother is also living with us, and we have a support system here that works for us. So I'm not really looking forward to go far away from here. And I am going to tell you what the next things I'm gonna do. I'm gonna tell you right now what are my goals. I will either become a nurse practitioner, family nurse practitioner, or a certified nurse anesthetist. I'm kind of balancing the two. I want to learn more about both of them, and I want to learn more about specifically nurse anesthesists because I don't know a lot about them, but I do like the idea of providing personalized treatment to one person rather than, having a lot of patients involved. That I like one-on-one patient care, but I don't know. I don't know if I see myself going through a 3-year program without working. I don't know. But I have to see. I have to see what the future holds. And I have to see what if I like it. I have to be able to like it in order to do it. Thank you so much for watching. I'll catch you the next time.